Welcome back to the KI Afternoon News. Good afternoon. I am Casey Freelove. We're going to talk about a topic that I think is going to be near and dear to a lot of your hearts, considering the lifestyle we've all been kind of forced into in 2015. Myself being a radio guy, I'm always trying to find time to scramble and shove some food down my throat during the commercial breaks, and those are very limited. So we're talking a little bit about the gulp and go lifestyle and how it's affecting all of our health. We're joined on the phone by health educator Dr. David Magnano to discuss a little bit. And first things first, Doctor, thanks for joining us today. How are you?
I'm doing good. Thanks for having me.
Yeah, of course. And I think it's a great topic. I mean, I like to talk about health at least once a week on the program. And this is certainly one that a lot of people can relate to, whether you're a parent who's got small children and you're on the run, or even if you're a retiree who just doesn't like to cook food. It seems like we've all been kind of forced into this corner where we're not thinking, properly, I guess, in my opinion, is the word, because we're eating fast foods, we're cramming food down our throat, and our digestive systems and insides are certainly taking a toll, correct?
Absolutely. And what a lot of people don't realize is that when the digestion breaks down, that leads to other problems. If you look at diabetes, if you look at cardiovascular disease, or even weakened immune system, chronic degenerative diseases, even arthritis, the one thing that all these conditions have in common is poor digestion. And it's that poor digestion is the foundation and fundamental to many of these other conditions, either getting worse more rapidly than they should or not improving as they should. So it doesn't get a lot of, notoriety, let's say, and there's not a lot of medications out there that we see on the commercials, TV commercials for digestion, but it's really a very important topic.
And isn't that odd, especially as football fans can relate? It's like every other ad during a football game is a commercial for some medical normality, that you're dealing with. But you're right, this one is not addressed. And it's funny because a lot of the other foods that are advertised during those games are probably part of what's causing the problem.
That is true. So you have all the foods that are advertised, plus all the medications to fix the conditions that ultimately result from poor digestion. It is sort of funny. I never thought of it that way.
Well, let's talk a little bit about what we can do and kind of a starting point. I want to talk about the differences, as you mentioned, and as I was reading the write-up. There's a difference between eating to survive and eating to thrive. And another issue that we want to talk about is the fact that we always feel forced into these time windows. It's breakfast time. You must eat now. It's lunchtime. You must eat now. And it's really just a bit of nonsense, right?
It really is. I mean, when we're hungry, our bodies will tell us. We'll get a hunger sensation, a hunger pain. And we do a lot of weight loss at a couple of our clinics here. And what we notice is if we can just get people to eat when they're hungry, not part of the 7 steps, but eat when you're hungry, eat slow enough to enjoy the food, and allow your body to recognize that it's full and you've had enough, and then stop when you're full. It's a very simple concept, but it's not so easy because of our lifestyle. And the other thing that's interesting, and we do this a lot with weight loss patients, is when you get a hunger pain or a hunger sensation, you don't know whether your body is calling for water or calling for food.
Interesting.
So what we ask our patients that are interested in losing weight to do, we ask them, you get a hunger pain or a sensation, you feel like you're hungry, that's fine. Drink 2 big glasses of water. Wait about 10 or 15 minutes, and if you're still hungry, then go ahead and eat. If you're not hungry, you really weren't needing food. You just needed some fluid, some water.
That's very interesting because I think oftentimes we can kind of be, that'll pass. It's just a hunger pang. It's kind of like a little mini withdrawal from not having food, and if you just drink some water, sometimes that can certainly help. We're speaking with Dr. David Magnano a little bit about your digestive health and really just your overall health because we're living in this fast food society. And there's a lot of good points I saw in the write-up. I want to talk about a couple of things. It's not a new concept that people overeat when they're stressed or ill sometimes, or even if you're hurt and you're just a little bit depressed. That's certainly something that's not new, but it does get overlooked. I mean, they don't talk about that enough. I think stress eating and really just kind of a gluttonous society is what's been built around advertising. So it seems like kind of the norm here, right?
Absolutely. Even some of the commercials are geared towards, you've had a tough day or you're having a tough time and, now's the time to eat and relax and be comforted by these foods. But digestion actually requires quite a bit of energy from the body. So if you're fighting a cold or a flu, an infection, or if you've recently had a trauma and you want that area to heal, or if you're under stress, mental stress has physical reactions on the body. These things will all distract from the digestion, make the digestion less efficient so you don't pull the nutrients that you need out, and also it puts an additional strain on the body. So even though we may, initially feel good going for that, it actually will make it worse, and it does not help. So when you're fighting something, it's a good idea to try to avoid the food. Even I'm 55, so when I was a kid and I was fighting something, my mom would give me soup. So broth and soup, those things are good when you're fighting something because they're pretty easy to digest.
Now, a couple of key points that I found just fascinating in reading the write-up in the background here is, you talk about the iconic American dinner. We want meat, we want potatoes. I guess in 2015 we try and throw in a side salad, but it's actually maybe not the best combination, but it's so embedded in our American minds that it's probably hard to unravel. Could you talk a little bit about that idea, I suppose?
Absolutely. The main thing we're trying to improve here is digestion. We're trying to get the good quality foods out of the food that we eat, the good quality nutrients, and we're trying to reduce the stress on the digestive system. So the classic American steak, potato, and salad, if you have sluggish digestion, which means after you eat you feel a little run down, you're overly tired after you eat, sometimes you have indigestion, gas, bloating, anything like that, that's a sign of sluggish digestion. So if you were to eat your food in a different sequence, you're still having the same food, you're just eating it in a different sequence to take some of the stress off the digestive process on your body. Basically, the best way to do that would be to have the steak. Wait a few minutes. Of course, chew your food and eat slowly, but have the steak, wait a few minutes, and then have the salad. And any raw vegetable or fruit is loaded with digestive enzymes. And the enzymes are the chemicals that help to break down the foods that we're eating. So if you can load up the enzymes, it just takes all that stress off the digestive system. In addition to that, because the food is now broken down, you're actually getting quality nutrients out of the food that you've eaten. Then after you've had the salad, then you would want to have the potato. So for sluggish digestion patients, we always try to sequence the food to take advantage of the digestive enzymes. I'll be honest with you, I don't always do that when I'm as busy as the next guy.
Right.
So we've started to add digestive enzymes. We've been using digestive enzymes for about 15, 16 years. And then we found this company, Nature's Sources, and they developed a product called AbsorbAid, which is just relieves a lot of the digestive stress because it's a powerful combination of digestive enzymes. You take it when you eat your meal. And if you're not following the sequence of food, you can still break it down and get a lot of benefit out of your food without putting a lot of stress on the digestive system.
So basically, you're just kind of simplifying it. So I assume this is something you would start the meal with, basically, and then go ahead and eat?
Absolutely. You could take it at the beginning of the meal, halfway through the meal, at the end of the meal. It's basically a digestive enzyme, and you're gonna help to break down the food. And the way it works is when we're chewing our food, that's sort of that's prepping the digestive tract. It's sort of greasing the tract. It's getting digestive acids and enzymes rolling. So the more enzymes you put in, the more the food is going to break down. And there's another point that if you're cooking foods, which we need to do with, meat and fish and chicken and pork, we need to cook it over 118, 119 degrees. We're actually losing the enzymes when we overcook a food. So that's why taking a supplement form of enzyme, very helpful. Eating raw vegetables and raw fruits, extremely helpful because having not been cooked, the enzymes are still pure and powerful.
And so the AbsorbAid part of it basically is just kind of like an extra layer of protection because, regardless, as you age, I'm 38, I'm already starting to feel it a little bit myself. I certainly can't eat the foods that my friends' children are eating anymore.
Yeah.
So you add this AbsorbAid and it takes a little bit of the worry out. So what exactly is going on? Is it like probiotics? Is it breaking down bacteria? Well, what is it doing for you internally while you're eating?
Well, what it does, the AbsorbAid by itself is a combination of digestive enzymes. They will break down fats and milk and cheese and protein and different things. So very helpful in breaking down things. We have just found that and started using ourselves, they have an AbsorbAid Platinum, which in addition to the powerful enzymes, they've added the probiotics to that. And of course, probiotics are the bacteria. They're the good quality bacteria in the digestive system, in the intestines. And that's about 75% of your immune system.
Wow.
So when you start to get a sinus thing or little scratchy throat, upper respiratory infection, 75% of how you can get rid of that comes out of the natural bacteria in your stomach. So I thought it was a brilliant move that they added some probiotics in with the digestive enzymes. And so when patients are a little bit weakened on the immune system, we'll encourage that product.
Well, and that's something that I didn't even think about until you mentioned it. Excuse me, doctor, because if I get because I'm in broadcasting, so I'm clearly concerned about my throat every day. I have to make sure that I'm able to get on the air and talk, and I never would have thought that it would be related to something that's going on with my intestines or my digestive tract. That's fascinating.
It is. And it's not so much new information because we've known about this for years, but we didn't realize how powerful it was in just fighting everyday stuff and toxins that comes into us. That probiotic, that bacteria, that natural good quality bacteria in our intestines is very powerful. So just a little side note, I woke up a couple of days ago, and always seems to start, you wake up a little bit of a scratchy throat, and so instead of taking AbsorbAid, I did the AbsorbAid Platinum, and that was my digestive enzyme that I used all day. And by the end of the day, my throat felt much better, and then so then I got a good night's sleep, and I never really got to the point of being sick, so I was very happy with that.
We're speaking with Dr. David Magnano here on KI, talking a little bit about your health and how to get a little more health and health benefits from some digestion issues. Now, doctor, if the listeners want to learn more, about background or what they can do, both naturally and using a product like AbsorbAid, where do they need to go? Okay,
so the website is Nature's Sources, and that's with two S's in the center. So it's www.naturesources.com. And then really how I got started with their products is you can call a 1-800 number and they'll send you samples. And the nice thing about digestive enzymes, some of the supplements that we take, we have to wait, 2-3 months to see a change.
Yes.
Or is this working? Well, with digestive enzymes, if you're taking a good quality digestive enzyme, you'll notice that it's working right then and there. So they have a 1-800 number, and you can get some free samples, and you can just test it out for yourself. The number is 1-800-827-7656. And I'll just tell you a little story that a study was done. There was about 100 patients, just shy of 100 patients. I think it was 89 patients. They were all being fed with feeding tubes. So they were very ill patients, unable to chew their food or anything like that. And the study allowed for adding AbsorbAid to their diet. And for these very ill people, they found that there was an increase in nutrient absorption of 71%.
Wow.
Just from adding that one thing. And that's for somebody that's not really moving around and is very ill. So if we